Okay, welcome. Greetings from the north. And if you did see my other video, the social edition of social distancing, social assistance, and emergency assistance, welcome back. My phone rudely cut me off. Take care of your tech so that it can take care of you. And I'll keep this briefer just so I don't run out of memory space and you don't run out of patience. Also, if you've been keeping up with the COVID alerts, medical experts are warning against exploring disinfectants, which is what some have been suggesting. But that's too risky, and we keep up on medical alerts. And the garden centers in Ottawa area have been reopened. There's more on that. You can look that up. And back to social assistance, social distancing, and emergency assistance. And what is the difference? So for CRRF, the CERF Residential Relief, the Canadian Residential Relief Fund, that goes to that's in Ontario, been distributed by the federal levels of government to the provinces, and those provinces, their elected officials are deciding how those are distributed. And so in Ontario, Premier Ford and his and the cabinet of Parliament here has declared 200 million towards social services, which, if you're wondering where that goes to charities and charities like meal programs and local donation centers, which are doing wonderful jobs helping those people that are in need, that are on assistance. And also services like food banks run by United Way or Canada Food Banks, as well as the provincial food banks and their organizations. Also, 40 million directly to housing programs in Ontario regions, which means paying for motel rooms for homeless families. In the region I'm in, there's 144 kids in Niagara Falls, the last count in 2019, and like 650 odd people that are homeless without shelters. So 40 million going into housing projects, well, not housing projects, housing programs to shelter the people, because we don't have money going into housing projects. More people are interested in CERB, the CERB, the Canadian Emergency Relief Benefit, and that's for those who are seeking EI or employment insurance, those who due to work loss, and everyone that's applying for CERB is demanding their money now, and that is very taxing to Canadian Revenue Agency, who is also receiving calls from everyone across Canada trying to find out exactly what they're eligible for. So look into what you're eligible for before calling CRA, and don't just assume that you heard something and that is what you are eligible for, because nobody knows your own case like you, or whoever it is that is privy to that information. Talk to them, and then talk to your and then talk to the Canada Revenue. Maybe get in touch with your own governments, your local governments, for your CERB, which is being distributed. The provinces got their funding from the federal levels, and then that was placed into different areas to assist with people that are suffering from a freezing of their finances. And if anyone in Ontario is an existing client of social services, then in Ontario, that's just tough. Ontario's premier decided long before COVID-19's outbreak that no new housing or cost-effective transit for public or limited healthcare services, by only including 20 medical groups in the original public release of Ontario's budget at the end of 2018, and the public education and the community programs like the addiction programs for various intake. And then we got neighborhood gardens, which have been addressed recently, and job skill training, which has been supplemented by online sources. So learn how to use those. There are plenty of tutorials. Just start searching. There's videos. There's websites. Find a job if you need one. And so Doug Ford's plan in Ontario is to donate huge tax revenue to charity, join a Meals on Wheels program, which I've done another video about that news-related article from Nursity. Help small business by putting poor sick families into small motels. And that's been the Ontario policy for years, like probably decades, where if there are no shelters or beds available, then the cities and the regions, those municipalities, are paying out of their coffers the money to put those people in a motel room for as long as they can, as long as those funds hold out. So definitely I see we need a lot more going into housing, because we desperately need not just the people that don't have housing, but the people that are already in various geared income housing. And so for the CERB, those are $2,000 a month checks going for in place of the employment insurance. And this is not a universal benefit. This is only for employees who have lost hours or wages. And then we also have ODSP and OW, who are covered under social services in various provinces and territories, and those are separate agencies. And if you want to know more about the disability or welfare programs where you are, then contact those services. In Ontario, however, the checks for ODSP, the disability, and OW, the Ontario Works program, if you combine both monthly checks without any additional benefits for whatever medical reasons or employment related costs, combined still equals $2,000, which is what this CERB coverage is providing. And there are no increases to the aid in social services, because quite simply there's a strong impression from those people whose funds are going into it that those receiving these benefits are not deserving of even the $2,000 a month. In fact, they get half or less than half, depending on which of the benefits you're on. And disability and welfare do not get the same amounts. And that has been a less than brief summary of social distancing, social assistance, and emergency assistance, and what the difference is. Thanks for tuning in.